Thank you so much. Dom Serafino won't be here today. He missed his second flight with some weather. But it's nice to have friends and colleagues, Jack Fisher and Richard Chaffoo, up here with me for a nice little discussion. Thanks for the earlier presentations. I think we can see that hair is a very big industry. It's a growing industry. The future is very positive. I think plastic surgeons need to dominate this space. Jack, I'd like to ask you, what makes a plastic surgeon the optimal choice for hair transplantations? Why aren't more plastic surgeons doing hair transplantation or restoration? And what can we do to change that?
So if you don't mind, I'm going to change your question around to fit what I want to say, which I always do anyways. First of all, I want to say Grant Stevens was a resident at Barnes when I was a visiting professor. So that shows you how old I am. But actually, I believe it should be the core group, which is plastic surgery, facial plastic, and dermatology. And the reason is, and I do a lot of teaching, and so does Dr. Chaffoo, to our colleagues. These three specialties have the basic and fundamental knowledge of all the components that are necessary to have a successful hair practice. When I do my teaching courses, it's very easy to teach these three groups, not only the fundamentals, but the sophisticated parts of it. Hair, and all of us who've done hair will agree with this next statement. It probably has some of the worst results of any area of aesthetic endeavor. At one time, 25% of my practice was redoing bad hair transplants. I've written 5 book chapters on bad hair transplants. So naturally, I would send a basket of fruit to all the doctors every Christmas who are doing bad surgery, since they were providing me with a substantial income. Is this being recorded?
Yes. Yeah.
Oh, shit. Okay. So, no, I didn't do that. But the nice thing about what you saw so far from several of the speakers is that not only are people in the hair industry wanting to sell you technology, they want to make sure you know what to do with the technology. And I think that's so critical. Is education is so important. You can't just give people a machine and say, God be with you. And so the education is an important component. I completely forgot what you asked me now.
It's all right. We'll move.
All right. Is that enough?
So Dr. Chaffoo, when we do transplants, we're essentially rearranging the hair on top of the head. So we're taking it from somewhere that's rich and we're giving it to somewhere that's poor. But as you heard earlier, there's potentially technology that would allow us to create new hair, which is a very different concept than what we've been doing going backwards. Can you speak to that a little bit?
Sure. Yes. Jack's a hard act to follow, obviously. Hair restoration has really not changed significantly since the 1950s or early 60s, when Felix Unger took the first few grafts from the back of the head and transplanted them to the front and presented at a dermatology meeting, and he was booed. They said it's heretical. How can you manage follicles removed from a donor area and move somewhere else? They're all going to fall out and the hairs aren't. But now that concept of donor dominance is essentially what we use in hair restoration. The problem is, in hair restoration, we have a limited donor area. Most of it is really related to the scalp, the sides and the back of the head. And when you've removed up to maybe 40% of that, you're done. So if you look at patients, the larger amount of loss that they have, and people that are obviously aged longer tend to have a larger hair loss, you'll get to a point of diminishing returns where there's just no more hair follicles to transplant. And so I was fortunate enough to be asked to become a medical advisor to Stemson Therapeutics, and I've gotten to know Jeff Hamilton and his amazing team at Stemson Therapeutics. This is really game-changing technology, and it's nice to see in San Diego we really are seeing a quiet revolution in the biotechnical field. Stem cell therapeutics is alone in this space. There is no other company that is at the point where we've created human hair follicles and truly created a cloning process that we've shown in an in vitro, and now you've seen in an in vivo model. Last week I was doing some of the mini pig hair transplantation with the research team. And so this is something that will really revolutionize hair restoration, because what we've been plagued with for so long has been that limited source and therefore the limited application of those hair follicles from the donor area, because as we all know, we're only born with about 100,000 follicles, and when they're gone, they're gone. We don't regenerate those. But now with this new model that Stem Cell Therapeutics has created, we really are creating new hair follicles. So essentially a patient at some point will be able to come in, will be able to get their induced their pluripotential stem cells, induce those into what Jeff said, the two basic elements of a hair follicle, the dermal papillae and epithelial stem cells, and grow out an unlimited number of follicles. You know, that has significant application, not just in hair restoration for male pattern hair loss, but in burn patients, in scars, patients that have had chemotherapy. So it can have a significant, not only an aesthetic, but a medical indication.
So sort of existing in this multi-billion-dollar industry, I want to make sure everybody knows that we're rearranging hair is essentially what we're doing today. It will be for the foreseeable future, at least for the next few years, but it's super exciting technology. Jack, with respect to the various technologies, a lot of times companies have a little schizophrenia, and they don't really, is their customer the patient, or is their customer the doctor?
Yeah, that really is a critical question, because we've all seen, and somebody even made this comment earlier about trying to figure out who is the customer. And I think with hair restoration, it depends what you're talking about. When you're talking about something like ARTIST technology, the primary customer, in my opinion, is the doctor, because it's a sophisticated piece of technology. Then the physician can educate the patient about the attributes and the benefits, et cetera, of that technology. But I think if companies start going straight to a patient or the consumer out there with very complex technology, I'm not sure it sort of gets the foothold. But then when you look at certain aspects of hair restoration, because today it's not just transplantation, there already have been presentations with PRP, certain applications like Propecia, minoxidil. There's a lot to offer a patient. 20 years ago, when I saw a patient for a transplant, I would look at them, and if they weren't a candidate for a transplant, I'd tell them, go away. I didn't realize that I had so much to offer. When a patient comes in for a facelift today and is not quite ready, the doctor doesn't just say, go away, come see me when you're ready for a facelift. They give them a whole litany of products and therapies that they can apply. And that's what's happened with hair. That is the patient population. That is the group that you market directly to the patient, and they come in to the physician's office and say, I'm aware of this, I'm very interested in it. So I think there's, to use the terminology, two silos. And it's not absolute, but you kind of need to figure that out. What do you think? Do you agree with me? Because if you don't, I don't want you to say anything.
I'm staying too close to you to disagree with you, Jack. No, I agree with what Jack said. And the other thing I think that we had mentioned when we were talking earlier on, you know, this is a great meeting, and I think that Grant Stevens and the others that have put this on, it's a phenomenal meeting. But I think one thing is missing is that much of the presentations that I've heard have spoken to the woman in the aesthetic field, which is certainly an important factor. Yet we're forgetting the largest growing segment in the aesthetic field is us, our guys. And, you know, a large portion of my practice, and I'm sure yours, is a male aesthetic market. And you could see from what Joey Brown showed that there's an exponential growth, probably higher than, you know, that last last bar graph in the male aesthetic market. And of all the things that we do and that I do as a plastic surgeon, I can tell you that when we do hair restoration on a male, it has a profound effect upon a man's self-confidence about how they feel, and it's a permanent change. And like Jack said, that's why I think it's really important to support those core fields of dermatology, facial plastic, and plastic surgery that are involved in this, because they have the basic credentials and training. But I think it's really important for us to take a step back and realize that we're missing a large segment of the aesthetic market if we're leaving men out of the picture. Because the men that have a hair restoration procedure are also, in my practice, and I'm sure in Jack's, the same patients that have Botox, that have fillers, that will have eyelid surgery, that have a significant other that's going to come in and have, whether it's a non-invasive or an invasive procedure. So there's definitely a ripple effect.
Yeah, that's so important. We've all seen this. A gentleman gets a hair transplant. The most common procedure they would come back to my practice for was a blepharoplasty, because they're looking in the mirror, they see they look better as far as hair, now they don't like the way their eyes look. And then they refer their wife for procedures. So none of these procedures are in isolation, and that's why I think it's so important. I do want to point out one thing. I consider myself a very prescient individual. For those of you who don't know what it means, it's being able to predict. Did you get that, Joey? Thank you. And I always felt I could predict the future. So 20 years ago, I said someday there's going to be a company in Boston that figures out how to create hair follicles. Well, I was wrong. It's San Diego, and I apologize, okay? But when you tie that together with technology, and especially robotic technology, the synergy there is incredible, because we've always been frustrated. We see someone who has extensive hair loss, and it could even be from burns, diseases like alopecia areata, and we have to turn these patients away because we don't have enough hair. And now all of a sudden, if potentially we have access to unlimited hair, it totally is a game changer. I'm sorry, I haven't given you time to ask any more questions.
Yeah, that's all right. Enough for you. You're done. No. So we're definitely now more looking at the scalp as opposed to just doing hair transplantation. And every patient that comes into my office gets a dermoscopy, so we can see if there's inflammation. We can see what's going on with the actual hair. It also is fantastic to demonstrate to the patient. And so we're doing things like PRP and Caravive and topicals with microneedling and steroid if we need to. Richard, what kind of non-surgical things are you doing for patients?
So that's a great question. I mean, I think from my involvement with Stimson, what we realize is that the causes of hair loss are multifactorial. And as I explain to patients, it's like looking at the tip of an iceberg. What we really know about hair loss is at the very top, above the waterline, but there's much more that we don't know. And so many things in medicine are multifactorial. So, I encourage patients to embrace medical therapy, usually this multifactorial, because while hair restoration will do great to replace the follicles that they've lost, it will do nothing to prevent further hair loss. And so that's a combination of medical therapy, whether it's finasteride, adding in minoxidil, because they work synergistically, different mechanisms. We do a lot of PRP in our practice, I'm sure as you do. There's light therapy. There are other treatments that are being looked at in the future. Perhaps it's exosomes. Perhaps there's something beyond exosomes. There are so many factors that we're still researching and trying to understand. But it's a complex problem. I think as we heard Jeff talked about the hair follicle, you wouldn't think that something that's that small is that complicated, but it is that complicated. And so this is something that we're trying to unlock the research on, and it's a combination of well-designed, well-executed surgery and thoughtful, science-based medical therapy that's going to give the patient the best outcome. So you really need that combination.
So I'm going to have us each list one technological advancement of existing technology that we think would be most useful. And so I think that the tensiometer for the artist, which is a device applied on the back of the scalp that stretches it out so that the robot can harvest. So it's about this big now. In my dream world, it would be large enough to harvest 2,000 or 3,000 grafts at a time. Presents some technology challenges for the engineers, but I'm hoping they can do that. Richard, what would you change?
So I'm going to steal an idea from Joey, because Joey, who gave the presentation for Venus, and I have talked much about the exciting world of robotic technology and how it's an evolving field. And one of the ideas that Joey came up with, which is a simple and a brilliant idea, and I want to give him credit for that, is that the robotic process is a coring process. And that's one step of it. But, you know, if we can add to that suctioning enough that the grafts can be harvested, we could increase the speed of the robot. And I think that that's something that probably could be engineered into the system and would allow a faster harvest rate. We're harvesting now 1,000+ grafts an hour, but it would make it.
So we're both basically answering speed. So with this device, you have to keep reapplying it, and so that slows you down. So if you're able to apply one and then just take 2,000 grafts an hour or something, it would be fantastic advancement for speed. And then if you didn't just core it, if it took it out as well, that's like a big substantial speed improvement as well. Jack?
I want to sit home in bed eating bonbons and watch the robot do a hair transplant. No. Are you sure this is being recorded? It's speed of harvesting, but again, it's the fact that even with the robot, you still have to manually take them out after it's done the coring. And with the brilliant engineers, I mean, I looked at the first robot about a decade ago, and I was not interested in it. It was very slow, very cumbersome. Mr. Brown was involved with the technology back then. But it's like all technology. It's amazing how quickly it evolves. And I'm sure they're going to figure out how to make it so it's retrieving the grafts, because that would really, really speed up the process. Erase the bonbon thing, please.
So last one. So we all have lots of technology. I have an ARTIS, a NeoGraft, a manual FUE. I'll do a strip if I need to. And I think you have a lot of the same technology, Richard. How do you, so we'll find that we might start with one technology and start with the robot, but the robot's just not seeing the hair that well, and then we'll switch to NeoGraft or in another direction, or sometimes we'll use the robot and manual FUE in between to sort of blend it all in. How do you choose which technology you're going to use, and how much say does the patient have in that?
Great question. So I think one of the great, side effects of new technology is that patients seek out this technology. So, I practice in La Jolla, so I see patients from all over Southern California, and Qualcomm is headquartered here. And I see a lot of engineers from Qualcomm, and they come to me specifically because of robotic technology, because all of us are aware of robots in our lives, not only whether it's building a Tesla, but it's the Da Vinci, and there's a lot of very positive press that's come about from robotic technology. So to answer your question, part of this is patient-driven. I'll have a patient that will come in and will say, I came to see you because you're an expert in robotic hair restoration. And then we'll have a discussion. We'll get out our dermoscope. We'll look at the scalp. We'll see, are they really a good candidate for a robotic technique? But I tell the patient, in the end, it's not the technology, if you were, it's the technician. Who's driving this device? And that comes with judgment, both aesthetic judgment and surgical judgment. And I think that it's having all those tools and knowing which tool to use in which patient. And as you said earlier on, sometimes I tell all my patients, we may start out harvesting robotically, and it may not work as well as we would like it to, or it may not get all the areas that we need to, so we'll have another device. So just simply owning a robot is not going to make you good at hair restoration. Owning a scalpel is not going to make you a good surgeon. So I think you need all that technology to be able to offer your services to a wide range of patients.
So we're aesthetic surgeons, and we make people look better, right? And I think plastic surgeons as a whole need to embrace hair transplantation more, because it's a phenomenal tool to make people look better, make people look younger, restore confidence and self-esteem. They're really some of our happiest patients. And so I thank you all for the time, and thank you very much.